Hi, welcome back to the Vet Dental Show. Today we're going to talk about a problem that we have in general practice. Every general practice has this problem, and it's associated with how we use antibiotics in our dentistry cases from a prophylactic standpoint. There's a wide variety of ways that we use this, and we're going to try to dig deep down into what the current recommendations are from some of the major players in our space, such as AVDC and AAHA, and then make some specific recommendations for you to use in your practice. And I've used this research and used a lot of the research that's done in humans that's supportive of the recommendations that they do in human dentistry, and combine these to create a document for you that I'm happy to email to you in order to use in your practice every day as guidelines to when to use antibiotics and when not to. We'll talk about those in general, and then that document will have specific recommendations for you, including antibiotic dosages and when to use what antibiotic for which pre-existing condition that you encounter that's clinically significant. To get started, let's look at where we're at with this from the standpoint of the current recommendations. So let's look at this a little more closely. In 2023, there was a published study that was funded by Mars for Banfield hospitals, where they looked at practices throughout the United States and what they were doing for their antimicrobial use in those practices. And they had a survey that they passed out to all of their practices, and 816,000 practices responded. So we've got a really good data set. And based on that survey, there was a really good summary done by multiple veterinary dentists at different institutions around the US and Canada, and they came up with a really nice paper that was recently published again in 2023. So the important thing that came from that paper not only were the recommendations from the major players like AVDC and AAHA, as I mentioned, but also the fact that most practices that use antibiotics, and this is 99% of those practices, had durations that extended to and were a median duration for dogs of 10 days, cats 7 days. So we're going to talk about what those recommendations are currently and how they differ from that shortly. So the recommendations that have been proposed by AVDC, the American Veterinary Dental College, from AAHA, and then thirdly, all past literature that address this point, were very general and very confusing. So from the AVDC standpoint, their recommendation that was published in 2019, so it's quite dated, was to reduce bacteremia for animals that are immune compromised, that have underlying systemic disease, such as cardiac disease, hepatic disease, or renal disease, or when severe oral infection is present. So that's from AVDC. Looking at AAHA, again, we've got some pretty broad recommendations. Antimicrobials may be indicated in patients with systemic risk factors such as subaortic stenosis, systemic immunosuppression, and orthopedic implants placed within the last 12 to 18 months. So the latter one is one of the ones that we can count on being important from an ongoing standpoint. One of the recommendations that we would have for you for prophylactic antibiotic use in practice, in addition to multiple other recommendations that we'll have for you. But that's the only real specific one that we can cite from any of these. And then past literature, surgical implants in general, with no indication on date, FIV, metabolic, hepatic, cardiac, pancreatic, or renal disease. And certainly you can imagine that spans a very broad scope. Geriatric or debilitated animals with pre-existing heart or systemic disease, or immunocompromised. So what I've done is I've looked at the literature and I've compiled a list of specific recommendations for you for prophylactic use of antibiotics within your practice. 5 different categories. And in each category, we've got multiple different recommendations for you based on the disease entity. Number 1 is immunosuppression. The second is recent implants, as we've just outlined. Clinical hepatic or renal disease. The 4th is metabolic disease. And the 5th is specific cardiac conditions. And the detail in those first 4 is pretty significant, but what I will do right now is just give you what those specific cardiac conditions are, and then I'll make recommendations for you on what type of antibiotics and when to administer those, and then I'll give you how to get those recommendations emailed to you so that you can use them in your practice. So for those cardiac conditions, patent ductus arteriosus, aortic stenosis, subaortic stenosis, unrepaired cyanotic congenital heart defects, endocarditis, and pre-existing pacemakers. So those are the 5 cardiac conditions that we would use antibiotics for. Any other cardiac conditions, including murmurs, would not be indications for prophylactic antibiotic use during dental procedures. Certainly murmurs, any murmur needs to be worked up, chest rads, EKG, and or cardiac echo in cases where those first 2 diagnostics suggest that there may be a problem. So take that into consideration as one of those categories. And then from the standpoint of this and all the other categories, the recommendation for antibiotics is not preoperatively, not postoperatively, but immediate preoperatively, 30 to 60 minutes prior to the procedure. And the choice of antibiotics is generally the beta-lactams because they're very effective against the gram-negative organisms that cause a lot of the systemic manifestations of the regional oral infection. And so covering for those while we're disseminating more bacteria into the bloodstream during these procedures is worth considering and is part of the protocol that we would recommend for you. In addition to that 30 to 60 minutes intravenously prior to start of the procedure, the recommendation is also to re-administer those at 2.5 lives for the individual medication or antibiotic. And the 2 antibiotics that are used most commonly are cefalexin and ampicillin, in addition to, in some instances, clindamycin intravenously. And based on those recommendations, re-administering those beta-lactams every 2 hours is what the recommendation is while the procedure is going on. So if it's a procedure that's less than 2 hours, you would not repeat that. If it's more than 2 hours, then you would repeat the beta-lactams intravenously. And then after the procedure, there are no additional recommendations for antibiotics to go home. Absolutely no indication for that. The only time that you would consider that is if there is radiographic CBCT or biopsy of bone to indicate that there is active osteomyelitis present that can't be removed surgically. So starting about 10 to 14 days in a chronic case, which most of our cases are, they're all chronic periodontal cases, or mostly all in that category, you're going to have radiographic evidence of osteomyelitis at that 10 to 14 day period if it's significant enough to consider using clindamycin for, and this would be 4 to 6 weeks minimum after the procedure. And so you really have to make the decision on whether or not you've got active osteomyelitis present before you would entertain using antibiotics for that extended period of time. So make sure that you have radiographic evidence. If you are one of the specialty hospitals or otherwise that have CBCT, which is not something that general practices are going to embrace or use in anytime soon in the coming years. But if you are at a specialty hospital, you have CBCT, and or if you have question, certainly biopsy that during the procedure, biopsy the bone that's in question. And then from that standpoint, again, as long as it's not osteomyelitis, we do not use post-operative antibiotics. So those are the recommendations that we have for you, and there are multiple recommendations. There are specific conditions that we use different antibiotics for, and all of those are present in a document in a table and with the doses as well as all of the indications to use those prophylactic antibiotics 30 to 60 minutes before, and then every 2 hours during the procedure. In order to get those recommendations delivered to your inbox, go to ivdi.org/AB, like antibiotics. ivdi.org/AB. Put in your email address, we'll send you that document, and we will update that document. That will be a virtual document that will update if there's any changes to those recommendations, and that way you'll have that ongoing and be able to use that for recommendations in your practice for antibiotic use for prophylaxis with pre-existing conditions that we outline in that document. So hope you enjoyed this episode. We'll see you next week.